to Abuja, the place that unites Nigeria.
Welcome to Nationwide on the network service of the NTA. Thank you for joining us once again. I am Lydia Odije-Ochi. Our first report from London says Information and Culture Minister Lai Mohammed has opened talks with his counterpart in the United Kingdom in an effort to fast-track the return of Nigeria's Ife bronze stolen from the Jos National Museum over 30 years ago. Anthony Forson has more.
The minister, whose visit to the United Kingdom was tied to media engagement, took time out of his tight schedule to visit the United Kingdom's Under-Secretary of State for Culture, Heritage and Tourism, where he presented Nigeria's case. Lai Mohammed, after the closed-door meeting, spoke on the outcome of his meeting, beginning with the brick wall being put up by the Belgian in whose possession the artifact was found while attempting to dispose it.
The object was put on the red list, which means it cannot be traded, it cannot be exchanged, it cannot be bought. So when this item surfaced in the UK, the auction house promptly notified the UK Metropolitan Police, who notified the UNESCO, and we were, notified through our UNESCO permanent representative. And since then, we've been pursuing the return of this artifact to Nigeria.
He, however, said the Belgian government on its part isn't making the process easy for Nigeria.
Regrettably, the Belgian authority claimed that they were not a party to the UNESCO convention at the time this item was bought by a Belgian. And then the Belgian buyer is also hiding under the provision of being buyer in good faith and asking for compensation from us. That's one fact, he's asking for €5 million for an object that he purchased for €240. Our position is that he's not a buyer in good faith, because he's not just an ordinary buyer, he's a collector.
Expressing satisfaction with the meeting, the minister said any form of litigation has been ruled out.
This is not necessarily a matter that should go to court. It's a matter that can be resolved, working within the provisions of the UNESCO 1970 Convention.
For now, Lai Mohammed said, with the cooperation extended to Nigeria by the United Kingdom Metropolitan Police since the matter came up, Nigeria will rely on UK in line with UNESCO's convention as a signatory to return the object to Nigeria under Article 7 of UNESCO Convention, which stipulates that any such objects found in any country which is a member of the convention, diplomatic channels shall be explored to return such objects to the country of source. In London, Anthony Forson, NTA News.
And back home, the federal government has commenced the mop-up of excess food items in circulation, especially grains, with a view to stabilizing the price of food items. And the food items are being stored in federal government strategic grain reserves in the country. Musa Baba Ali reports that the Minister of Agriculture and Rural Development, Mohammed Sabo Nanono, was in Gusau, Zamfara State to inspect the exercise.
It is a 9.4 billion naira project set aside by the federal government to stock the country's silos with assorted food in case of an emergency. This is based on the United Nations recommendation that countries should keep substantial amounts of what will last for at least 3 days in case of an emergency. The food items are to be kept in 6 of the 33 silos, which have the capacity to store more than 1 million tons of grains. This grain reserve located in Gusau is 100,000 metric tons capacity, and it has already been stocked with 23,000 tons of maize and sorghum.
We've been able to mop up almost 54,000 metric tons. We have them here in Zamfara, we have in Lafia, and we have in Mina.
Minister of Agriculture and Rural Development Mahmoud Sabananono described the initiative as a move to ensure Nigeria is more food secured.
This year, from all indications, we have a bumper harvest, and we are going to study the situation, and if it warrants us intervening again, we will, in order to stabilize the prices at the farm gate as well as in the market.
It is the hope of the federal government that buying of excess grains from farmers will go a long way in boosting their income. From Gusau, Zamfara State, Musa Baba Aliyu, NTA News.
We now go to matters concerning health. The federal government will soon launch emergency contact response with a view to controlling outbreak of diseases in the country. The Minister of Health, Dr. Osagie Ehanire, dropped this hint during a visit to Aminu Kano Teaching Hospital to receive first-hand information on the recent Lassa virus outbreak that claimed the lives of 2 doctors in the hospital. Yahanasu Hassan Barau was there for NTA News and now reports.
The minister's visit to Aminu Kano Teaching Hospital is to commiserate with government and people of the state over the demise of 2 doctors, Dr. Habib Musa Muhammad, a consultant anesthesiologist, and Dr. Kulthum Abba, a house officer who died after they contacted Lassa virus in the course of discharging their duties. This development has provided a springboard for the federal government to take far-reaching measures in curtailing the disease outbreak.
No one should panic. Those who are responsible for looking into the occurrence of this disease are working and for detection, prevention, and also response.
More than 100 people are now under close supervision to prevent further spread of the disease.
Classify as high risk category. It will be placed on medication. That medication will prevent development of the disease itself. At the same time, also will be recording your body temperature just in case the disease will develop again, which is very, very unlikely.
The minister also inspected the intensive care unit at the hospital, equipped with state-of-the-art facility to suit the emerging trend. He also took his time to visit the families of the deceased over the demise of their loved ones and prayed for the repose of their gentle soul. Meanwhile, activities at the Aminu Kano Teaching Hospital resumed fully after a partial closure of some units following the outbreak of Lassa fever. In Kano, Yahanasa Hasambaro, NTA.
As the world grapples with the recent outbreak of the coronavirus, health experts have called on Nigerians to take precautionary measures such as environmental sanitation to prevent the disease as well as Lassa fever. Daniel Aderie reports that they also advocate adequate sensitization in curtailing the scourge.
Current increase in cases of Lassa fever across parts of the country is eliciting concern from many, including these guests on Good Morning Nigeria. Though they agree that progress has been made in curtailing the scourge, they insist that concerted efforts beyond what is currently on ground must be in place to help find lasting solutions to mitigate the effects.
I won't put it as a spread because it's there, it occurs, and if it's carried by a vector, and the vector during the dry season begins to invade homes when food is scarce, that's when you see more cases. Research is going on all of it, and there's progress on vaccines against Lassa, which is being done in collaboration with IRWA and foreign researchers.
Like food items cannot be vehicles for the transmission of this illness, but people are encouraged to cook the food items properly, simply because the cooking raises the temperature high to such an extent that probably the viruses die.
They also highlighted factors such as rural-urban migration and an increase in the quantity of food produce being transported across the country as reasons for the upsurge in the cases being witnessed across the country. They also pointed that proper and prompt diagnosis can help cushion the adverse effects.
The more people move around from where there's an infection and where they have had a contact with an infected person to another place, the more likely they would take that disease from that place to the new place where they have gone.
In extreme cases, when you begin to have bleeding from orifices, from the nose, from the ear, from the mouth, people who don't bleed from the gum before will begin to, following just brushing. At that point, a clinician managing such case must raise his or her index of suspicion and must call for help.
They, however, called for continuous sensitization and education on the dangers of poor hygiene.
Thanks, Daniel, for that report. Abdullahi Mustafa is standing by to give us an update on the outbreak of Lassa fever in Kano. Abdullahi, if you can hear me clearly, what is the current situation following the outbreak of Lassa fever in your state, which claimed, unfortunately, the lives of 2 doctors at Aminu Kano Teaching Hospital?
Lydia, the situation is actually under control from the information gathered from the Ministry of Health, Kano State, and Aminu Kano Teaching Hospital, because the first index case was discovered in the hospital during an